Good evening, everyone, or good afternoon, or even good morning, depending on where you're joining us from. Before we begin, I'd just like to mention if everyone wouldn't mind muting their Zoom so that we can avoid any background noise, it would be greatly appreciated. We've also enabled the chat function in this Zoom call, so you can send questions, and Dr. McLaughlin will get to them at the Q&A portion of the event. Obviously, you can always also speak with when you're unmuted, if you wouldn't mind, if you'd like to say your question outside of the chat and live in person, if you wouldn't mind just noting in the chat that you'd like to be unmuted as opposed to everyone jumping on each other, it would be appreciated. As Donna mentioned, my name is Andrew Siegel. I'm the Director of Strategy and Operations, as well as the fourth generation owner of Hamilton Jewelers in Princeton, New Jersey, and in Palm Beach, Florida, coming to you tonight from Princeton. On behalf of my father, Hank Siegel, who's the president of Hamilton, as well as our vice president in charge of advertising and events and community relations, Donna, who just spoke, and of course, on behalf of Dr. Mark McLaughlin, I'd like to welcome all of you to our virtual Meet the Author event this evening. I'd like to start by saying that I, along with all of us at the Hamilton Jewelers family, hope that you and your families are safe and healthy right now. Hamilton is used to hosting various events with clients from around the world. And adapting to the realities of the coronavirus pandemic has meant that while we can't host you all in person, we were able to extend this invitation to many people who would not have otherwise been able to join us in beautiful Princeton this evening. So we're happy to have you here, and also happy to have the doctor here to share some insights about his work and his book. Dr. McLaughlin is a longtime friend of Hamilton. We recently profiled him in our Accent magazine. So if you'd like a copy or more information on the Accent magazine, simply let us know in the chat function this evening. A resident of Princeton, Dr. McLaughlin is a practicing board certified neurosurgeon, a national media commentator and speaker, and the author of Cognitive Dominance, A Brain Surgeon's Quest to Outthink Fear. He is also the founder of Princeton Brain, Spine, and Sports Medicine Group, and a thought leader and keynote speaker in the areas of performance enhancement and medical admin relations. The doctor's interests also include coaching youth wrestling, and he is the founder of Trenton Youth Wrestling, dedicated to providing inner city youths with skills and mentorship. We cherish our relationship with the doctor here at Hamilton, and we're pleased to have him speak with you all this evening. Welcome, Dr. Mark, and I will pass the Zoom baton over to you.
Thank you, Andrew. We good?
You're good.
Excellent. My wife, Julie, tells me I always try to supersize things. She wants to have a couple over for dinner. I want to throw a party. She wants to go for a walk. I want to hike a mountain. And after 28 years of working on her to get her to say yes, to get a dog, and Sally, you know this because we worked on her together, she finally said yes. And my answer on that day was, why not two? I like to think big. I can't help it. And I like to think deep. Here's what's been on my mind lately, and I wonder, maybe yours too. How do you make sense of senseless things in this world? How do you make sense of a senseless world? You know, my mom was a school teacher for 35 years in New Jersey. And just back in May, she got infected with the COVID virus. And unfortunately, she passed away from complications of that virus. I was one of the lucky ones. They let me put on protective gear because I was a physician, and I got a chance to get in and see her and give her a hug and say goodbye. But my brothers and my sister, they had to stand outside a window 6 feet away, unable to give their mom a hug and say goodbye. How do you make sense of that? How about another one? This has been, in my mind, maybe yours. I love my country, and yet I'm embarrassed and ashamed at some of the things it does. How do you make sense of that? And here's another one I struggled with for years. I love my job, and yet sometimes I absolutely hate it. How do you make sense of these things? Discrepant thoughts, incongruous concepts that you're wrestling in your mind with. It's uncomfortable. There's a name for it. It's called cognitive dissonance. Cognitive dissonance, which is the state of having inconsistent thoughts, beliefs, or attitudes, especially related to behavior decisions and attitude changes. What's the solution? What's the solution of making sense out of senseless things? Well, I can tell you tonight, I don't have all the answers, but I'd like to share with you an experience and a concept that for me helped me in one sphere of my life blow cognitive dissonance out of the water, to literally wipe it off the mat. And that experience is the writing of a book, and the concept is cognitive dominance. Cognitive dominance is enhanced situational awareness that facilitates rapid and accurate decision-making under stressful conditions with limited decision-making time. That's a mouthful. But boiled down to its essence, cognitive dominance is a tool to help one make sense of senseless things. And my hope tonight is to share with you this experience and the concept in the hope that you can make use of it and it can help you wrestle with cognitive dissonance and help you make sense out of senseless things in your life. So this was what I wrote. And if you boil it down, it's an adventure story about a big idea that I learned that helped transform my life and my attitude towards my profession. And the essence of it is three underlying pillars. And that is relationships, the pursuit of excellence, and service. So first, relationships, and particularly family relationships. Some of you who registered for this discussion early, you got one of these in the mail. And if you have one, do me a favor and hold it up and give it 2 good hard squeezes. And then again, 2 hard squeezes. Hear those sounds? That click and the ta-tink, the little jingle, the click of the butts of this plastic and the little jingle of that figure of 8. Whenever I hear that sound, it takes me back to 6th grade. It takes me back to climbing into my dad's car after a wrestling practice, totally exhausted. And what did he have in his hands? He had one of these things, and he'd squeeze it, and I'd hear that sound. Click, click the tink, click the tink. And if he didn't have this thing in his hand, he'd reach over and he'd hold my hand. And as we drive home, he'd give me 2 squeezes, just like he did on the gripper, a little more gentle, but just the same way. And we never spoke about it. It was sort of our unspoken Morse code. I love you and I'm here for you. My dad had really totally calloused hands because he was totally into health. In fact, back in 1946, when he was 18 years old, he got into weightlifting, back when it was considered ridiculous or even dangerous to do something like that. But he found that it gave him great energy, and he was a huge proponent of it for us in all of our lives, and that it would augment us in sports. And Dad's gripper, that was his talisman for fighting idleness. Perfect execution of squeezing over and over again. And the lesson that he taught me from that is that health is always a priority. Exercise gives you not just physical strength, but it gives you cognitive energy. You know, as I said, when I was a kid and I'd grab his hand, my hand was soft and clammy after wrestling practice, and his was all calloused. Well, I can tell you, when he got sick and it was time for me to say goodbye to him, and he was too tired to even say a word, he said those words with 2 grasps, just like he did when I was in 6th grade. Squeeze, squeeze. I'm here for you. I love you. He passed that on to me. And now that you have a gripper, he passed it on to you too. The number one lesson I got from that was never waste a second of your life. Always continue to keep working on yourself, which leads me to the second pillar of the book, and that is the pursuit of excellence. It's another lesson that my parents taught me and taught me to work for always, is to work to become the gold standard of what you do, the gold standard. For generations, people have been fascinated with gold. I mean, it's for 8,000 years, the alchemists looked into trying to convert lead into gold. They believed that you could take a compound and exert a force on it and turn it into something better, turn it into gold. And it's been pursued for many years. The alchemists were some of the earliest chemists and scientists. And we think of it as just some crazy science where people were trying to convert lead into gold, but they were actually onto something there. Not only physically, but metaphysically. And a number of philosophers and scientists have looked into this. And what they saw was that there was a metaphysical concept that the alchemists were often after too. And that is the fact of a transformative moment, something that exerts a pressure on an object and changes it. Just like elemental carbon with heat and pressure turning into diamonds. That's a physical change. But other changes like turning chaos into order, turning senselessness into senseful, into understanding what's going on. And in fact, that's really why I love coaching wrestling, because I believe wrestling is the alchemy of the mind. What I tell my little wrestlers is, when you cross that line, when you actually step over that line and you're on your own in that center, in that circle, doing what you need to, and you continue to work on it, you're pursuing excellence. You're turning yourself literally from lead into gold. That's what that sport does. Another example of a transformation that, again, I was fortunate to see in my parents was my father, who pursued a 40-degree law career, ultimately retired at the age of 71. And he went back to Drew University, became a student again, studied religion and history, and at the age of 82 began writing his first military history book and completed his second one at age 88. He transformed himself from a lawyer into a scholar and a historian. It's a great lesson that passed on to me. The alchemy of your personality, the alchemy of your mind. And lastly, the third pillar that I want to talk about is service. And it's a lesson I learned over many years, and I chronicle in my book. And I learned it through a young patient that I met in the summer of 2000. The boy's name was Anthony LaCoury. And he came to the emergency room and was brought by his parents because he had fallen off a school bus and cut his face. And in the emergency room, the doctors there were examining him, and the parents said, you know, our boy's not right. He's been clumsy. He's been sleeping a lot. His father and mom owned a pizza parlor down the street, and he was like dad's number one helper. And he was dropping things when he was bussing tables, and he wasn't acting like himself. So I was consulted on him, and a quick MRI scan showed that he had a brainstem tumor, a tumor deep in his brain that was pressing on some of the vital structures of his brain. And I was right out of training. I was a young surgeon. I had just gotten out of the University of Pittsburgh. I had finished my fellowship. I had 8 years of training under my belt, and I had had a top training experience. And I knew I had all the skills to help him. So I took Anthony to the operating room. Another day, two later, I prepared him, positioned him in the prone position with his face down. I made an incision behind the back of his head and shaved off a disc of bone and came down right on top of this very angry looking brain tumor. 6 hours went by under the microscope, shaving this tumor off of his brainstem, every cell, trying to get it off, trying to preserve his brain tissue, trying to get the tumor out. The operation went perfectly. And I brought him to the ICU that night, and he woke up and he was neurologically intact. And I thought, wow, this is great. This is why I'm here on earth. I love this. I love this job. And he really did well for about 24 hours. But then he began acting strangely. And I got a call from the nurse. And they said, come and see, we need you to come see Anthony. He's not acting right. So I came in to see him the next day, and he had stopped talking. And when I touched him and I tried to examine him, he shrieked at the top of his lungs as if I was hurting him, causing him immense pain. And I took him down for a CAT scan. I checked everything. The surgical area looked fine. It was clear. There was no evidence of any tumor. But Anthony just wasn't right. He had developed a very rare complication called cerebellar mutism, which is an unusual complication of children's brain tumors where they become mute and they shriek when you touch them, and they are apathetic and they just lay in bed and they don't do anything. So as troubling as this was for him and for his parents, it was also for me. I reassured them. I said, usually this resolves. It's a complication that's rare, but it can happen. And we continued to treat him and watch him. Then another day went by or two, and he began developing a fluid buildup on his brain. So I had to do another procedure to bypass the fluid. Then another day came and the pathology came back. Malignant tumor. Not good. Not a good prognosis. A few days later came and he developed an infection. Back to the operating room, back to the ICU, back to his parents. Then the shunt got clogged. The tubing that I put in to bypass the fluid buildup got clogged. And as I cared for this young boy, day after day after day, I just saw him slipping through my fingers. I saw him getting these neurological insults that would set him back more and set him back more and set him back more. And over the course of literally 3 months, this poor boy suffered. He suffered, and his parents suffered. It was very, very hard to see. And finally, he stabilized. And he was ready to go to rehabilitation and ready to move on to oncology and get his care that he needed. And on the day he was ready to go, his parents, who were always understanding and just such wonderful people, they said, "Doctor, we want to get a picture of you. We want to get a picture of you and Anthony." And so they took a picture of me, and I stood by Anthony's bedside, and this was the picture they took. It's a picture of me as a young surgeon and Anthony as a young boy. And truth be told, I faked this smile. I faked it because there was nothing good coming to this kid. Nothing. And it was really hard for me, but I said goodbye to him. I said goodbye to his parents, and I tried to move on. Well, he left the hospital, but he didn't leave me. And that was when I started going for these long walks at night, saying, wow, this is, what's wrong with this world? Like, I thought I was going to get all my training and be really good at this, and I never expected to feel like this. I never expected this. This is terrible. I just want to crawl under a rock. And, I would go for these walks and I would ask myself, like, what could I have done differently? Could I have been a little more meticulous? Did I retract on his brain tissue too much? Was the surgery too long and that's why he got an infection? Could I have picked up the fluid buildup earlier and bypassed it so they didn't need a shunt? I asked myself all these questions over and over and over again, and I felt terrible about this. I knew he had a bad outcome, and I felt like I was responsible for it. Like that I maimed this child. And, I had people around me say, hey, it's a tough case. You'll get over it. It happens. But it didn't sink in. And being around loving family and great partners, I just had this terrible feeling about Anthony. I ultimately just sort of did what I think a lot of people do with bad experiences. I just suppressed it and pushed it down and just tried to move on. But I changed my thoughts. First of all, I stopped doing pediatric neurosurgery. I just couldn't bear to have another Anthony. And I ultimately didn't even want to stay where I was. I ultimately moved to New Jersey, maybe in some way try to get away from that experience. And I started my practice here, and I moved on. And I took this picture and I hung it up in my office. And every time I'd walk by it in my office, I'd think of Anthony, and I'd be sad. So 15 years went by as I was practicing here, and I began writing this book, Cognitive Dominance. And as I began writing it and putting the stories together, I thought of Anthony, and I thought, wow, here I am talking about overcoming your fear and figuring out ways to incorporate how you can use fear to be more functional. I got to find out what happened with Anthony. So I got on the internet, and I got on Facebook, and I looked up LaCorey's Pizza Shop in West Springfield, Massachusetts. And sure enough, the pizza shop was still there. And I scrolled down a little bit, and I saw Mr. and Mrs. LaCorey. And I scrolled down a little farther, and I saw, oh my God, there's a 24-year-old man in a wheelchair at Rockefeller Center with Mr. and Mrs. LaCorey. Anthony's still alive. I can't believe it. So I called them up, and I drove up that weekend to go see them. I said I wanted to see Anthony, and I wanted to share with you what I've been thinking about. And I came to the pizza parlor, and I saw Mr. and Mrs. LaCorey, and I saw Anthony. And Anthony is in a wheelchair, and he's definitely has disabilities, but he's still there with his mom and dad in the pizza parlor. And I told mom and dad I was working on this book, and how I had always thought that I had bad outcome with Anthony, and I felt that I had let them down. And they came around the table, and they gave me this big hug, and they said, God, Dr. McLaughlin, what, are you kidding me? You're our hero. You saved our boy. You saved him. And they gave me another picture, and it was a picture of me with my family and Anthony and the LaCoreys. And I had totally forgotten about this other picture. It was a picture that they gave me when I left Springfield and came to New Jersey. They had that picture on their wall. And it was a picture of what they viewed as triumph and happiness. And the LaCoreys just gave me all this love, and they gave me all this gratitude. And I came home with a present for my wife, and pizza, and the picture that they gave me. And as I got in my car to drive away, I realized, like, oh my gosh, I had this thing all wrong. I kept thinking that along this one way, I had told myself a story about Anthony. And here I had done my job, and I did provide them with the service, and I eased his suffering, and I did fulfill my mission. And what a great privilege it was to take care of Anthony and to meet the LaCoreys. And even though I had this terrible feeling in my heart for 15 years, now I wouldn't trade that for a second of my life. It was an incredible feeling of experience and good feeling. And when I called my editor and said, I've got the end of the story for Anthony, he said, so what do you think about it? And I said, well, I'm really happy about the service of this thing. And he said, Mark, you've been holding yourself to an impossible standard. No one can live up to that standard, And I finally realized that. And writing this book and having this experience of understanding how we all do that sometimes. Don't we all hold ourselves to impossible standards and put ourselves through a story that we tell ourselves that it isn't true, that everyone around us knows isn't true? That's the story of Anthony, and that's one of the stories I I talk about in my book. So I want to leave you with one or two thoughts before I take questions, and then I'll give you a closing thought. And what I'd like to say is, when you experience cognitive dissonance, when you're trying to wrap your brain around something senseless, talk about it, dissect it, reconstruct it, turn it upside down, look at it through the lens of relationships, through the pursuit of excellence, through service. Remember that nothing has inherent meaning in it. We ascribe the meaning. And if you have the right tools, you can find meaning and a solution that's consistent with your mindset and with your worldview, and you can act accordingly. So before I take questions, I just want to read a short passage. So the creative, heroic course of action I'm recommending throughout this book is a way to make that constant life companion of fear or a feeling of restlessness because of senseless acts representative of what it really is. It's simply a signal from your inner warrior standing on the wall between fantasies and reality. And the signal it's sending you is simply to pay attention to something that just happened that you didn't expect. Unpack that thing, dissect it, figure out what it means, and do some deep thinking about how it relates to what you want out of life and what you need out of life and what you firmly believe in and what you value. Thank you. I'll take some questions.
Thanks, Doctor. So if anyone has a question, you're welcome to type it in the chat, or feel free to unmute yourself and go ahead.
So, Mark, can you hear me?
I can.
Okay. So you started the conversation talking about making sense of the senseless, and I feel like we're in the absolute thick of it right now in our world. How do you reconcile that when I feel like there's like a general malaise. Everyone's kind of going through kind of a brain fog right now, that we're all kind of just out of sorts and just not on track. How do you wrap your head around getting some sense of whether that's habits or routines changing or whatever it is? How do you reconcile that?
Sure. One of the diagrams I have in the book is it's a 4-quadrant system with an X and a Y axis. And the X axis, think of as objective things in the world, like material things, objective things. And on the Y axis, think of subjective things, things of meaning. So when we're faced with something that is, we don't understand what it is, we don't know what to do about it, it's unexpected, it's not congruous with our worldview, we need to kind of map it out into one of those 4 quadrants. And what I say is it objectively positive or negative? And is it subjectively positive or negative? And let's say if it's subjectively positive and objectively positive, then you're in that upper right-hand double positive quadrant. And that's what I call flow. That's when you can do no wrong. Don't let your brain think about it. Just go with the feeling and act, because that's going to be a positive experience. But let's say it's objectively positive, but subjectively negative. Okay. So that puts you down in the lower right-hand quadrant. Okay. That's what I call the calm before the storm. That's where things don't make sense. That's why you're in cognitive dissonance. So you need to understand where you are on that. I'll move around to the other quadrants and then we'll talk about how to solve it. Let's say it's objectively positive, subjectively negative. That's like getting a job promotion and then realizing that the new boss you have is miserable to work with and it's not really a good thing and you're not going to be able to stay with this position. That's a partially positive, partially negative. Then you could have an objectively negative, subjectively negative. So that's in the lower left-hand quadrant. That's your all is lost quadrant. That's when you get a diagnosis of cancer. That's when something really, really bad happens. That's another quadrant that we need to somehow pull ourselves out of. And then the upper left-hand quadrant, that's when something objectively is negative, but subjectively is positive. So those are the experiences where we say down the road, you know, that was a terrible experience, but I'm glad it happened because, oh my gosh, did I learn so much, and I birthed a new skill set in that quadrant. And so you have these 4 quadrants: flow, calm before the storm, all is lost, and birthing a new skill set. And what we have to realize is that the heroic journey is really to move through each of these. You're never going to totally live in flow. The world wouldn't be fun if everything you did was 100%, nailed it. You've got to struggle. You've got to have your one foot in chaos and one foot in certainty. So when you're hit with something like COVID, like what's going on in our country today, I think the first thing you need to do is figure out where you are in that 4-quadrant system. And then I think the next step is to ask yourself, what are my deepest, most meaningful goals in my life? And commit some micro action, whatever smallest minutia it could possibly be to move you towards that goal. You're going to move yourself in the right direction. And that's going to be a positive feedback loop for you to climb yourself out of an all is lost, or for you to birth a new skill set that you need to move back into flow.
Thank you.
Doctor, I have a question for you. Your framework that you talked about tonight, pursuit of excellence, relationships, service, it's those are the, not to simplify them too much, but those are so many things that we in our industry deal with all the time, right? We're trying to be more authoritative, do better for our clients, provide high levels of service, and it's all about the relationships for us. So much of, I imagine you do some speaking with business people, as well as outside of as well as inside the medical field. But when you see someone, or if you were to encounter someone in the business world who's not achieving that level of cognitive dominance, who's not sort of at the level that they're expecting to be at, what would you say is most typically the thing that is stopping them? Is it fear? Is it fear of the unknown? Is it something else? Is it past experiences that they're not utilizing the right frameworks to understand, like you mentioned today? Do you have any thoughts on that?
Sure. One thought is there's a really fantastic book called Thanks for the Feedback that I recently read by Sheila Heen and Douglas Stone. And one of the great lessons they impart in this book is that, when you're receiving feedback or criticism, and I think this is everyone's weakness, and particularly maybe with somebody who's hard to manage or hard to talk to, if you can adopt a mindset that, okay, somebody's criticizing me now, and I don't agree with it, or I don't necessarily agree with it, or I completely categorically don't agree with it. Ask yourself a question: what could be right about this criticism? What could this person actually be right about in any way, shape, or form? And if you can open that window up just a little bit, I think that's where you can learn. That's where you can learn about yourself. It's funny, I talk to my wrestlers a lot, and I'm giving a talk tomorrow to 500 wrestling coaches. And for wrestlers, I'll tell you what a wrestler's blind spot is, a weakness is that wrestling's about imposing your will on somebody. That's really what it is on the wrestling mat. And that's a great skill to have when you're trying to master yourself and overcome adversity. But it gets in the way in relationships. It gets in the way in negotiation. You can't have that attitude when you're negotiating with somebody. In fact, you have to check that attitude at the door. You have to come with an attitude of service and gratitude for a win-win type of a situation. So that would be the first thing I would counsel somebody if I was managing. I say, hey, look, you may not agree with my criticism, but just ask yourself, what what could be right about it? What's a possibility? And that's your first step, I think, towards cracking through that. I hope that helps.
For sure. One of the things that, personally in my professional career, when I come to an event that is not as expected, or something that's a little bit off, that may throw me off, I love your acronym in your book, IRISE. And to be able to look and identify the event and stop that immediate gut feeling and really take control of the situation. I was wondering if you could talk a little bit about that for our group here, in case they're a little less aware.
Sure. So, IRISE involves immediately identifying. I tell the story of a young girl that I'm operating on, and I have an endoscope inside her head, and all of a sudden the screen gets blurry and I can't see. So I think that the tip of the scope is probably clogged or blocked. So I'm about to pull the scope out when my attending says, "Don't move a finger. Don't move anything. Keep the scope exactly where it is." And I look up, and there's profuse bleeding coming out of the back of the endoscope. And I'm like, oh my God, something's, some vessel tore or something. And my immediate reaction was to just pull that thing right out, just get out of exactly where I was. And he said, "No, you need to leave the channel in, because then the bleeding will all come out and it won't push on her brain. We can give her more blood, but we can't repair her brain if it gets damaged." So really what it identifies is your initial reaction to almost anything that's unexpected is the fight or flight, like run away or deny or react to that. And you need to reject that. You need to reject that concept so that you can reassess, what are the things around me? What other resources do I have around me to answer this question? And then react again to really kind of reorient yourself.
Thanks.
Hi, Mark. Matt Adrians.
Hi, Matt. How are you?
I'm well. Very good to see you.
Great to see you.
So I have a very simple question, which is the dominance piece. What is it that you're trying to dominate?
Great question. You're trying to dominate the primitive part of your brain that worked great for thousands and thousands of years to help you survive. And that's your amygdala and your limbic system, which is constantly on the alert. It's actually on the wall, protecting you from threats. It's that chill in your spine you get, when you feel danger, you sense danger. And it's important, but it works it's needed so infrequently in modern times that we have this developed neocortex that needs to override it. And it needs to be trained to jump in when you're getting signals from your amygdala. So it's not dominating others. It's dominating the lesser you to be more effective and be alert and make decisions that are more effective and more win-win for everybody around you.
So do those impulses that you're talking about from the amygdala, do those show up as thoughts, feelings, attitudes? I mean, how do they reveal themselves?
Emotional anxiety. And we talk about the gradient of fear, which I've learned through your wonderful company, Workability. And so what it is really at certain levels, it's like a gain mechanism. Let's say, you hear something outside your door at your apartment, you kind of get a little nervous, but then if the door gets kicked in and there's an intruder, that's a whole different level of fear. That's when your amygdala is in full firing, and you need to fight or flight, but
yeah.
If you get criticized in the boardroom for an idea that you had, that same reaction comes to you in a lesser way. And what you need to do is you need to identify it, reject it, and then move on and let your neocortex kick in and come up with a solution to what's come up with that's unexpected.
That's great. Thank you.
Hey, Dr. McLaughlin, how are you doing?
Oh my goodness, Daniel, how are you doing? How's med school going?
Doing well. It's hectic, but it's going. Can you hear me? Okay.
I can hear you great.
Great. So I just want to say first off, thank you for inviting me. The book was fantastic, by the way. Really loved it.
My pleasure.
And I have a question kind of related back to the graph. So you were talking about how you want to use your deepest and most meaningful goals as the subjective. But what's your recommendation on, I guess, for people approaching and then constantly like reevaluating what those goals are?
Tell me a little bit more. I'm not sure of your question.
So in terms of the graph, the way I kind of looked at it, if you're in a situation that might be stressful, you have to make a quick decision, you'll evaluate what's, the good and bad, the positive and the negative, objectively. Yeah. And then in a subjective way. So the subjective is going to be whether or not it's in line with your goals.
That's correct.
Life goals. And kind of that like pyramid that you had mentioned in the book and that hierarchy. But what's your recommendation on, not necessarily in a situation like that, but in general, figuring out what those goals are and kind of finding meaning, I guess. So rather than utilizing the meaning you already have, figuring out kind of how you can continue to, I guess, transcend in that aspect.
All right. I think I have a better idea now. So I think particularly as a young person, you can get pulled in a lot of different directions. There's a lot of distractions and shiny things out there, and it can be confusing because you can see different pathways that you could move on to. And I think that boils down to how you were raised. What are the stories that you've accumulated throughout your life? What gives you the most joy? And I've always believed in the Paulo Coelho concept. The alchemist. I've always believed that everybody knows deep down in their heart what they're supposed to be. Everyone kind of knows what their personal legend is. I believe that. And you just need to listen to that voice because if you don't listen to it over time, it can disappear. And so knowing what your personal legend is, knowing, again, why I'm here on earth. That's a question I ask myself, especially when I'm having a bad day. And you've been with me with some of those bad days. I mean, there are terrible things that we see. You can't unsee the tragedies that you see in neurosurgery. They stick with you. So what helps me is okay, what's your purpose? Your purpose is to ease suffering. So you may not cure somebody, but you can always ease their suffering. You can always be of service to them. So I think that those are the important things you need to think about. What gives you the most joy? What serves you? What serves the world? And and then there's a great Jim Collins quote too, where you got to make 3 circles. What you're inherently good at. What are your God-given talents? What you love to do, and what can pay the bills and make you a person who's productive in society. And the intersection of those 3 circles is what you need to shoot for. I hope that helps.
Thank you so much.
It's great seeing you.
You too.
Mark, if we could just close out on one question. You, in interviewing for our magazine, we kind of ended on one topic regarding the importance of dreams and how, kind of unresolved thoughts manifest at that time. Could you just touch a little bit about your thoughts on that topic?
Sure. I've read a lot of psychology textbooks, and I'm a big fan of Carl Jung. And he truly believed that that dreams were important parts of our lives, that they were the birthplace of thoughts, and that they should be thought of, analyzed, and interpreted. And it's been interesting because I've talked to a couple people who have read my book and said they've had some vivid dreams and even some nightmares. And I said, well, that's good because it means it's stirring some thoughts, some deep thoughts in you. And you can use that to help make sense. I mean, if it's pretty obvious if you deprive a subject of dreaming, of the dream sleep state, you literally lose your mind. They're of critical importance, and the psychological experiments are very clear that if you wake somebody up before they get into REM and experience dreams continuously, they'll start losing their mind. They'll start losing their sense of reality. So the thing about dreams, the current thinking is that it allows you to sort of experiment with thoughts. It's also a pruning of not useful thoughts away, and so that the circuits, the neural circuitry of your brain remains more streamlined. And so it's an important part of our life, and we need to get enough sleep to allow that to happen. I think a lot of people don't get enough sleep and they don't have enough dream state, which could also be a form, cause of cognitive dissonance, I think.
Great. Thank you.
Yeah.
Are there other questions for Dr. McLaughlin?
Coach Mark, I have a quick question if we have time still.
Sure.
So part of your book is about fighting fears. For me, and maybe for some other people, I think I move slower when I have a big task ahead. Even for wrestling, right? You have a tough opponent. Sometimes we're not up to our ability when we see something that is more challenging. Just in a couple of sentences, when you have like a really big assignment, what's your routine? How do you go about being your best self?
Sure. It's really reverting back to the basics. So what I do when I'm about to do a very difficult case or a high stress case is I really focus on the very basics. If it's a tumor, it's get around it, shrink it, remove it. Get around it, shrink it, remove it. Get around it, shrink it, remove it. It's the most basic thing. Surround the enemy, capture its blood supply so that it's not bleeding, dissect it away from normal tissue, and gut it, and then get it out. So I'm constantly trying to think about, let's say it's an emergency trauma surgery, okay, and there's a fracture over a large vein. So I'm thinking, okay, what are the 3 things I got to do to make sure that this person doesn't lose their whole blood volume when I expose their that torn vein? All right, so I got to make sure that the anesthesiologist has the control of the bed to raise the head of the bed. I got to make sure I have certain patties to tamponade it. I've got to make sure that I have a big sucker so I can see what's torn. I got to have a suture ready that I can close it with. So it's really just thinking about the very basics, because almost invariably, you're prepared for that test. You have put the time in and you're ready for it. But sometimes the nerves and the anxiety can make you forget about the basics. So the basics, if you were taking a big test, I would say basics would be, did you get enough sleep? Did you eat a good meal before I went in there? Have I reviewed, the top 5 things that I knew I wanted to know going in? And, with wrestling, it's, control the tie-ups and, keep your hips, in a scramble, keep them high, and those are the kinds of things that I think will get you in the right mindset, because your brain is an operating system. So if you start putting in the data that's going to make it put the output out, if you put the right data in, it's going to come out with the right information. Breathe. That's another one. We find when we're really anxious, we're not breathing deeply. You got to get some air in there and really let your training take effect.
Awesome, I agree.
Thanks. Any others? So, Andrew, do I have 1 minute to just close?
Absolutely.
Sure. Okay. So I just think, it's saying I'm wearing my dad's Rolex watch. He gave this to me, and he loved this watch because not because it was fancy or ostentatious, but because it represented craftsmanship and quality, the highest of quality. It represented brand excellence. And it's no coincidence tonight that we were all brought together by Hamilton Jewelers, whose cornerstones have always been family, have been the pursuit of excellence, and have been service. And I think if there's one take home for tonight, it's that those three values are touchstones for a really meaningful life. And they're touchstones to help you make sense out of senseless things. So I hope that this was worthwhile for you. It was a pleasure to see everybody. Thank you for your time. Andrew and Hank, thank you. Donna and Lauren, thank you. And to all the participants from Russia and Canada, my nurses, my colleagues, my friends, my former wrestlers, my Princeton Brain and Spine staff, thank you so much. It's an honor to serve you.
Thanks so much, Doctor, and thank you everyone for joining us. We appreciate you, and everyone have a great evening.
Thanks.
Thanks.
Thank you.
Thanks, Mark. Great job.
Thank you.
Wonderful.
Mark.
Gratitude.
Thank you.
Thank you very much.